Sir, in case
Yes,
of alcohol withdrawal syndrome, like when
yes.
do you usually start with the anti-craving agents? And which agent do you prefer to use, sir?
This is very important question actually, and if I go answering this bit elaborative way, then I have to say something is that what I believe is that behind every addiction there is some mental illness. I used to run a neuropsychiatrist setup where we used to work in a team of psychologists, psychiatric social workers. So we undertake a very thorough neuropsychological evaluation, psychosocial evaluation, and we try to find out what lies beneath, why that person has become that much of addicted, and depending on that. Say, for example, in most of the cases, if I need to say, most of the cases in alcoholics, basically, we are getting anxiety disorder, where people try to dissolve their anxiety. We used to get some sorts of depressive disorder. We used to dissolve their depression in that, or other axis 1 diagnosis. So these things is to be considered first. If we see a pure anxiety disorder patient, then we see that we can skip the anti-craving agents. But in some patients, like various sorts of personality disorder, like borderline personality disorder or antisocial personality disorder, and all those cases, then we used to start anti-craving from the, you can say, the very first day. Then what we used to cautiously, we used to lower the dose of chlordiazepine oxide. If we use, say, for example, baclofen, that is also having action on benzodiazepine receptor. So based on the clinical picture, we decide what type of anti-craving is to be given. Because our main motto is to, after detoxification and after discharge from the hospital, how to maintain the sovereignty, uh, uh, how to maintain that patient away from alcohol. Based on that clinical picture, we have to decide when and which anti-craving is to be used. I suppose I clarified your doubt from my perspective.
Thank you so much, sir. So basically, I think we need to understand that behind every addiction there is a some disorder, and we have to treat that disorder also. And holistically, we have to see a patient and then choose one anti-craving agent according to the patient profile.
Exactly,
Thank you
exactly.
so much, sir.
Or psychosocial
Yes, sir.
conditions, and those things needs to be evaluated by appropriate professionals. So for example, if you talk about the psychosocial evaluation, so we have psychiatric social work who evaluate the patient from their professional angle. Again, the psychologists, they evaluate the patient from their angle, and in a unified approach we used to attend the need of the patient, and finally we maintain, even our staffs used to make the house visit to study their family condition and other psychosocial factors. So our approach is bit holistic, and we always try to beat 100 out of 100%. And we are working at that level also. If the poverty is the reason behind the relapse, we adopt the patient and we ensure free medication, free services, and everything. Thank you very much.
Thank you so much, sir, for an elaborate answer. Dr. Debashri Sanal, do you have anything to add on this about the anti-craving agents and which
I
one do
don't
you
think so.
prefer?
It is fairly exhaustive things that has been said by Dr. Hamid. I think nothing more to add on to this.
Does anyone have any more questions? There is one question, sir, in the chat box. So it is in the same aspect. So basically, the question is, out of naltrexone, baclofen, and acamprosate, which molecule is used in which and what type of patient profile as anti-craving agent? And any expert opinion on that? Dr. Anirban, sir, if you have any comments on this question.
See, the criteria, as Sir has rightly pointed out, it is not only about giving anti-craving agent, but the comorbid or the underlying mental health condition is also to be. We also have to assess that condition also. So usually, after detoxification, most of the time in clinical practice, we use baclofen and other drugs like naltrexone, acamprosate. These are sometimes used after if the patient has like not responding to baclofen, the craving is like higher, then the dependence is higher as assessed by SATK questionnaires and all. So then the other like naltrexone and acamprosate.
Yes. I on this point, basically, there might be some newly passed out psychiatrists, new generation of psychiatrists might be listening to this webinar. For that, those actually consider my message is that see, naltrexone is very costly molecule, and so the acamprosate is also. And we are working in Indian context where 80% of the population lives in a village setup. So we have to take consideration of that factor. And what I infuse in what I try to infuse among the young psychiatrists is that the sentence I already have told that behind every addiction there is some mental illness. So say for example a patient having ADHD, regardless of the anticraving you use, you are not going to get the response. So that is to be kept in mind. So and what we are seeing is that except for all those personality disorders, we can maintain the patients abstinent from alcohol without the uses of these costly molecules like naltrexone or acamprosate. Yeah, baclofen is a very safe, cost-effective, and if we take on baclofen along, then outcome is much better.
Thank you, sir. Thank you, Dr. Nirmal. Thank you, Dr. Rizal, sir. I think we can conclude the session now, Arjun, if there are no more questions.
Yes.
Yeah, it has been very
Yes,
exhaustive and very learning too. For me, it was a very learning experience.
Thank you very much once again. Thank you, Dr. Devashish Shanok sir, for nicely moderating the session. And once again, thank you very much for covering the topic on AWS. That is our respected Buddha speaker, Rizal Hamid sir and Aripan Datta sir. Thank you very much for taking your precious time out and making this event possible on the Sunday evening. I understand Sunday evening is a totally family time, but in spite of that, taking your precious time out and really making this event possible. And same time, I want to thank you all the participants over there for attending our scientific session on AWS. Sir, currently we are doing virtual as well as physical event. We are continuing this scientific program. So thank you for associate with us. In the future also, we'll do in virtual and physical mode in both the forum. So once again, thank you very much and good night to all of you, sir.
Good
Thank
night.
you, sir.